So there's a million ways to treat ankle arthritis, from pain pills to doing nothing, right? And anything in between. I prefer regenerative medicine techniques because although most insurance companies still consider these experimental, therefore they don't have to pay for them, regenerative techniques are to date the only thing that has even a remote chance of getting cartilage to heal itself. So what the pictures I'm showing you on the top, the left is an ankle replacement surgery, which I do. These are great surgeries for end stage or ankle arthritis that is beyond being able to be treated with regenerative medicine techniques or anything else. We actually do ankle replacements, just like people get knee replacements and hip replacements. Ankle replacements are a great surgery. They had a bad history years and years ago, but the technology has improved dramatically. The results are awesome. The implants last 15 to 20 years. I love doing ankle replacements because everybody that gets them is so happy afterwards, and they're still able to walk normally, as opposed to those that have ankle fusions, which is the other option for end-stage ankle arthritis. That's when you actually connect the ankle to the talus. It eliminates the pain, but it also eliminates normal motion. Remember I showed you all those spiral lines and how everything from the big toe to the hip is connected and matters? Well, think about if your ankle doesn't move at all. Think about how that's going to mess up that whole cycle of gait and biomechanics I showed you. So I don't like to do fusions unless it's absolutely the only option for somebody. So these are your two surgical options for end-stage ankle arthritis. But for my purposes, for early arthritis or people that have decent amount of cartilage left, I have long conversations about all of the regenerative options out there, from connective tissue matrix injections, which are actually derived of amniotic tissue after a live birth. The amniotic sac, which is normally thrown away after a C-section, can sometimes be reprocessed and used with the mother's permission for a medication. They've been using this in eye surgery for forever, and then in orthopedic surgery for nearly as long. Now we can actually offer it as an injection for a lot of people. Sometimes you have to be on anti-inflammatory med. Let's say you have lupus. Let's say you have rheumatoid. Maybe you have to be on Humira or Enbrel. Who knows? But you need to get that diagnosed. The connective tissue matrices and the things like platelet-rich plasma and other regenerative techniques have growth factors. Okay, these are things that actually promote reduction in pro-inflammatory or catabolic responses, reduction in proteins that damage cartilage. These are called proteases. They're actually like enzymes that go in and chew up good cartilage. And then they have pro-healing and factors, growth factors like platelet-derived growth factor, things like that. And these are all natural, drug-free, not synthetic, and very, very safe. Versus steroid, which personally I am not a fan of steroids because of the massive amount of tissue damage they actually cause. But again, steroids are cheap. So they're totally covered by all insurance plans, and most insurance plans will tell you that's the first tier treatment you should do. But if you look at the data on steroids, the long-term outcomes in people is not so hot. So I try to avoid those unless it's the absolute only option for someone. And then there's other injections you can do, like hyaluronic acid, which again, not covered by insurance for the ankle. Toradol you can do. Platelet-rich plasma we talked about briefly, and then stem cells, which are awesome. But totally not covered by insurance and pretty expensive, but very, very good for early arthritis, in my opinion, based on all the literature I've read in my experience. But again, considered experimental by most payers.